Hi, my name is Julie, and I'm a healthy breast educator and women's health educator, and also work as a massage therapist, lymphatic therapist, and yoga teacher. For the last 9 years, I've been specializing in treating women that have had cancer, and also women that have a condition called lymphedema, which is a dysfunction of the lymphatic system. And over the years, as self-care, I began introducing breast massage as a way for women to treat themselves when in between visits. And so today we'll go together through step-by-step a way to incorporate a very simple routine that you can do at home. The benefits of self-breast massage are very many, and the top 3, I would say, is to begin to work on reducing scar tissue that you might have in your breast tissue, to reduce pain, especially cyclical pain, pain that comes with your period or that you begin to notice on a monthly basis, and also to decrease swelling in the breast tissue. So as you go through this routine, it's important to create an environment that is comfortable, where you can have, privacy and also the time to practice this massage. Often women practice in the shower with natural soap, or they could use olive oil, pomegranate oil, or healthy breast oil, either after a shower or before bed. That's a common time. When you practice this massage, you might notice emotions come up. And so sometimes with touching the breast tissue, fears can come up, or feelings of discomfort. And over time, we can take note of these different judgments that we might have about our bodies, and begin to work through things like self-body image, and fears that we have about breast cancer, for example. If you do have active breast cancer, or any undiagnosed tumors, it's best to go to your doctor and not practice this massage until you get clearance from your doctor. And during the massage, if you do notice any abnormality in your tissue, it's important to go to your primary healthcare provider. But keep in mind that 80% of any lumps that you might find are non-cancerous. And so please, don't panic. With me is my colleague and also healthy breast educator, Whitney Denard, and she'll be volunteering to demonstrate the self-breast massage routine. And I'll go through step by step, and provide modifications as we go along. So the first step is, let's talk about the techniques that are available. And so one technique that I like to use is without oil, and addresses specifically and activates the lymphatic system. And so there are 3 different hand positions that we'll go through today. And one of them is with a flat palm. And so palm is open and fingers are straight and together. Another technique is the grasp. And so it's kind of like a pincer grasp. And the third technique is using the whole hand in palm and going over the contour of the breast tissue. So for the first technique, which is a lymphatic drainage technique, we're working without oil and directly on the skin. And so if you take your arm, we can practice, if you place your hand on top over the skin, and you apply just enough pressure that you can drag and stretch the tissue and release. So drag and stretch the tissue without slipping and release. And so you need to feel the elasticity of the tissue beneath your hands. So that's what we're looking for. So let's try that on our neck. And so the first technique would be to give yourself a massage. So you'll use your pincer grasp hands and give yourself a shoulder massage. Relaxing your shoulders and relaxing your neck tissue. And so the next step is with your flat fingers to place the hands on either side of your neck, and we'll form half circles, so semicircles, first dragging the skin back towards the back of the room, down towards the floor, and then releasing forward. So again, we'll try this 5 times. Back, down, stretching the skin, and then allow the skin to recoil. Again, back, down, release. Remember to breathe deeply and allow your fingers or your hands to really conform to the shape of your neck. And then finding your collarbone. So some of us don't know this, but our breast tissue can go all the way up to the bottom part of the collarbone, the breastbone, and also around the side of the ribs. So the next technique is you locate your collarbone and then finding the space just above your collarbone. So find that space. And then crossing your arms with 2 fingers, press down into the space and release. Pressing and releasing. And we'll try that 5 times. So when we press here, this is called the terminus. This is part of our lymphatic system. We're creating a little bit of negative pressure within the system, and that increases the flow of your lymphatic system. We'll repeat that sequence 3 times. So placing your hands on the side of your neck, and then let's stretch the skin slightly back, down, and releasing forward. So as we stretch the skin back, down towards the floor, and then it recoils forward. And performing this 5 times. That looks great. So remembering to really stretch the skin, and then we're carrying the skin back, down, and releasing forward. And then remembering the terminus, crossing your arms, pressing in with 2 fingers with gentle pressure and release 5 times. And placing hands on the side of your neck, we'll try 1 last time. Stretching the skin back, down, and releasing forward 5 times. And crossing your arms, pressing with 2 fingers in the space just above your collarbone, and release. We're pumping the terminus. Remembering to relax your shoulders and your neck as you're doing this. Relaxing your jaw. Great. And then release your hands. Placing your right hand in your left armpit and finding just the crease of your armpit, and relax your left arm. And we'll press into the tissue and release. So pressing in and release. And so we're need to stimulate the lymph nodes that are in your armpit. So there are many lymph nodes in your armpit and also in your neck. And this will help with the drainage of your breast tissue. And let's try the other side. Placing your left hand in your right armpit and relaxing your right arm, pressing in and release 5 times. The pressure is in towards the tissue and slightly up towards the armpit, and release. Release your left hand, and we'll try the same lymphatic technique on the side of the breast. And so placing your right hand on the side of your ribs And then let's lift or stretch the skin slightly back and upwards and release forward. So it's similar to what we did in the neck. So we're stretching the skin towards the side or the back, and then up towards the armpit and release. 5 times. And then on the side of the breast tissue, and we're beginning to stretch the skin back, up, and then release forward slightly. So imagine that we're moving lymphatic fluid up towards the armpit and draining into the lymphatic system. The last hand position is right at the top part of the breast near the armpit and moving the skin back and up towards the armpit. Sometimes if there's fluid, some women say that they feel a tingling feeling, or they might feel a bit of achiness if there's a backup of fluid. And release. And let's try that again. Placing your hand at the base of the breast, and let's move the skin back, up, and release towards the armpit. And then the side of the breast, back, up, and release. And the last position in the armpit, back, up, and release. Great. So next, if you were working with oil, you might consider using your Healthy Breast oil, your olive oil, your pomegranate oil. And placing one hand on the outside of the breast. So let's bring your left hand on the outside of our left breast. And with the right hand, we can make circles from the breastbone, so from the sternum, in circles towards the armpit. So partly some of the fluid in the breast tissue drains into the area of your nipple. And so we're imagining that we're moving fluid there. We're massaging the tissue in that direction. And then starting below the breast, releasing your left hand, making circles from the bottom of the breast or underneath the breast tissue, all the way up to the nipple line. So all the way up. And getting the bottom part and a little bit of the under part, the side of the breast tissue, towards the nipple. One technique that works especially well if you have very large breasts is this kind of sweeping technique. And so we can think about stroking. So stroking from the bottom all the way up. And one technique that you can add to this is kind of a ringing motion. So we can bring the hands in this position together, and then starting at the root of our breast, or the base of our breasts, ringing all the way up towards the nipple. And we can do that several times. Great. That looks great. And then taking care of the outer part of the breast tissue, we have 2 techniques. The first one is the circle. So we can, with gentle pressure, begin to massage in a circular motion the side of the breast all the way up to the armpit. And then finishing with the stroking. And so we can begin to stroke all the way up, from the bottom all the way up. Great. And then to create space and also to increase the drainage, behind the breast tissue is a space called the retromammary space. And often when we wear bras that are too tight, or we've had different surgeries where there's scar tissue, for example, breast reductions, or any kind of removal of the breast tissue, if you've had cancer surgery, for example, there could be a bit of a backup in fluid there. And one way to work with that is through the massage that we've just done. And another technique that can be done over clothes or after your massage is by taking hold of your breast by placing one hand beneath and one hand on top. And then imagine that you're moving the breast away from the chest wall and then up, and then away from the chest wall and down, and then from side to side. And so we're mobilizing the breast tissue, and also we're beginning to stretch the connective tissue that might be a little bit adhered. A natural way to do this is by walking around without a bra on, right? The natural movement of our breast tissue drains our breast tissue. And another way is rebounding. Rebounding is very good to mobilize the breast tissue. Great. So let's try the other side. Yes? Okay. So the first technique that we'll try on the other side is the positions of the hands for the drainage. And so placing your left hand over the side of your right ribs, let's move the skin back and up and release forward. And so thinking about that stretching of the skin, it's very important. And then on the side of the breast, so stretching back, up, release. And then closer to the armpit, moving back, up, and releasing towards the armpit. So we're opening up the lymphatic channels and creating a little bit of negative pressure in the vessels to promote the drainage of our lymphatic system in this area. And then starting from the bottom again, stretching the skin back, up, and release. And so we do this a minimum of 5 times. And then the side of the breast, stretching the skin back, releasing upwards and slightly forward. And the upper part of the breast into the armpit. And then one more time, starting at the bottom of the breast, stretching the skin back, up, and release. A minimum of 5 times. The side of the breast, and then working up towards the armpit. Releasing your left hand, we'll place the right hand on the outside of the right breast, and then with your left hand, fingers pointing down or towards the nipple, making circles towards the nipple line. And so we're thinking about massaging from the inside part of the body, so from the sternum over to the nipple. So from the breastbone, working towards the center of the breast tissue. Okay. And then from the bottom, so we can draw circles with our right hand, working from the base of the breast tissue all the way up to the nipple line. One technique that's really helpful again for larger breasts is the sweeping or the stroking movement with the hands, starting from underneath the breast tissue and working your way up towards the nipple line. And then placing your hands over each other for the ringing technique, starting from the bottom of the breast and working your way up towards the nipple. You can try that several times. And releasing your arms. Placing your left hand on the side of your right breast and making circles from this outside of your breast all the way up, using your fingers and the palm of your hand, and with gentle pressure, working up towards your armpit. And then releasing your hand. And the last technique, placing one hand below the breast and one on top. And imagine that you're lifting the breast tissue away from the chest wall and moving the breast tissue up and down and to one side and to the other side. And so mobilizing the breast and working on softening or releasing any kind of stuck tissue, any adhesions you might have there. Great. And so that is the end of our Healthy Breast self-massage routine. Please note that if you've had any removal of lymph nodes in your armpit, the routine would be a little bit different. And so if you have a mastectomy on one side, rather than moving the fluid or thinking of massaging in the direction of the armpit on that side, one technique could be to think about moving to the other side. And so if you have one side where you have lymph nodes and one side where you don't, you can think about massaging in the direction of the armpit that has lymph nodes. And if you don't have lymph nodes on either side, you can think about massaging the breast tissue in a downwards direction. And so we can think about massaging towards the navel. And so this would move the fluid from an area where there's congestion to an area that can accommodate more fluid. So an area that has lymph vessels and lymph nodes. Please remember that during this routine, if you find any lumps or anything that feels unusual, that our breast tissue changes at different times in our lives, but also in the month for some of us. And so bringing that to the attention of your doctor can be very helpful. But keep in mind that 80% of what we find in lumps are usually non-cancerous or benign. I invite you to try this practice and to share it with other women that you might know. It's often practiced in conjunction with other therapies that you might be undergoing. It can really complement your self-care regimen if practiced once every week or 2 weeks. And if you'd like more information about the courses that we're offering or more information about breast health, you can visit our website at mammalive.net. Thank you, and I hope you enjoy this little clip we put together for you today.